the visceral adiposity, that belly fat, is associated with high levels of insulin in the body and insulin resistance. And that means that the body isn't listening to its insulin as well as it used to. And so that high level of insulin, as you mentioned earlier, causes us to store calories and to just gain weight.
And if you have belly fat, it matters. This conversation will matter because we're all struggling with it. And today we're going to talk on our special house call episode with Dr. Elizabeth Boham. The thing about it, it's a huge problem and it's so easy to fix. We are in a staggering health crisis, not just COVID, but the whole pandemic of chronic disease that's driven by poor metabolic health and this phenomena of being over fat. You can be overweight or you can be over fat or you can be both. We're going to talk about that today and why it's so important to think about for our own health, for our longevity, for preventing disease, and just for feeling good and actually even just getting our own lives together and managing our appetite and our metabolism and our energy and all the things that affect us. So I'm so excited to talk to you about this. This is my favorite topic.
Oh yeah, mine too. Mine too. And we know that where your fat is in your body makes a huge impact. That fat that's deep inside the belly, the visceral adiposity, that belly fat deep inside the abdomen is really concerning in terms of overall health. And like you mentioned, it's a huge issue. It's creating so many health problems, from just feeling crummy to tired to causing cancer, increasing our risk of cancer like breast cancer and prostate and colon and lung cancer. Of course, increases our risk of diabetes and cardiovascular disease, increases our risk of Alzheimer's disease and cognitive decline. It increases our risk of stroke and blood clots and high blood pressure and infections. As you were mentioning earlier with COVID, we realized that people with too much fat, people who are over fat, people with too much visceral adiposity have an increased risk of COVID-19. They have they have lower immune systems. They have increased risk of erectile dysfunction and infertility and PCOS and hair loss in the wrong places, and they make it harder to lose weight. So it's just connected to so many things, and it's unfortunately so common. We can't just liposuction this away and your blood pressure is not going to come down. And so if there's one thing that people can focus on, this is like the basic thing that everybody can focus on. If we just pay attention to what's our waist circumference and what's our waist to hip ratio, because that's telling us how much belly fat we have.
Weight might be perfect. It might be less than 25, 23 in their body mass index, which 25 or more is overweight, but they may be full of this visceral fat, and they can be diabetic, they can be thin, and they look thin. We'll call them skinny fat. So they have the same issues as someone who is overweight, but they're just over fat.
Yes, or TOFI, right? Thin on the outside, fat on the inside. So if you are a smaller person, then that's where also that waist to hip ratio can be really helpful. And you're right. No test is ever perfect. For some people, the waist circumference or the waist to hip ratio isn't giving us all of the information. There's a lot of other biomarkers that, of course, tell us that somebody has too much visceral adiposity, that somebody is carrying too much weight around the belly. And what's amazing is to watch them improve when we make shifts or changes in somebody's lifestyle, there's lots of things that can contribute to this, from toxins in the environment to shifts in the microbiome to poor diet, having a nutrient poor diet, eating too many refined and carbohydrates and simple sugars, not getting enough exercise, poor sleep, too much stress can all contribute to it. But when we shift somebody's lifestyle and when we make shifts in these issues that they're dealing with, we see these markers, these biomarkers improve significantly. So it's really fun to watch. We see it improve all the time.
And there are many causes, but the major cause is our ultra processed high starch sugar diet. That's the biggest cause, because that drives insulin, and insulin drives all the available fuel that you've eaten into your fat cells in your belly. And then it keeps the fat there, prevents this breakdown process called lipolysis of your fat, and it produces all these inflammatory compounds, and it screws up your hormones, and it makes you hungry all the time, and it slows your metabolism. So it's the worst possible thing. and it's really driven predominantly by that. So we know that a high carbohydrate in the sense of starch and sugar diet, because vegetables are carbohydrates, so you can eat as much of those as you want, is the biggest driver of this. But there are other causes, right? And you mentioned a few of them. So let's kind of go through some of the unusual things that might be driving this, whether it's the microbiome, toxins, and other things that drive inflammation.
I always, just in the terms of the most common cause, right? I get so concerned when I see, a young child, maybe like 8 or 9, and their parents are buying them a muffin and a sugary coffee drink or sugary, beverage for breakfast. And I'm like, oh no, it's just a setup. It's a setup for them to have problems for their whole life, and I think that it's important that people take care of those basics, like you mentioned. Sometimes people are doing, or they feel like they're doing everything right, and there's hidden reasons for why they start to develop visceral adiposity and that belly fat when they're really doing a lot of things correctly. And one of the things that I find that people don't realize is what happens when they start to lose lean muscle mass as they get older. We might be exercising a good amount every day, but if we're not working really hard to maintain that good lean muscle mass, what happens after the age of 25 is we slowly lose lean muscle mass. And then it's just so much easier for the body to put on excessive fat. And we know that having good lean muscle mass and exercising really keeps our insulin sensitive. And so that's one thing that slowly catches up with people, and they become more insulin resistant over time. And you mentioned
Yeah,
toxins. Unfortunately, there's been multiple toxins associated with this visceral adiposity. Yeah,
because you basically said something really important
absolutely.
around muscle loss when you get older, and muscle loss is really can be thought of as replacing muscle with fat. So you could be the same weight at 65 than you are 25, but be twice
Yep.
as fat, and that fat in your muscles is not just in your belly, is also this poor metabolic fat. And it leads to this increasing phenomena with all the consequences that we see of disease. So I feel like this is a really important thing that people understand. So exercise, basically strength training, building muscle, and aerobic exercise, even interval training, will help improve metabolic function and help keep this insulin resistance at bay as we age. Because it is something that affects almost everybody as you age, unless you do something actively about it.
You do have to work really hard at it. I mean, it's like so easy to maintain. Well, I don't know if it's so easy, but it's so much easier when you're younger to maintain your lean muscle mass. And as you get older, it's really work, and people are like, I do go for a walk every day. And I'm like, it's not enough for you right now. And getting in 2 days a week where you really are working on resistance type exercise, there's so many ways you can do that. That really can make a big difference. So yes, so toxins. BPA is a toxin that's been unfortunately associated with with visceral adiposity, fatty liver, metabolic syndrome. And BPA, bisphenol A, is that hard plastic that is pervasive, unfortunately, in our environment, and has been associated with, breast cancer, but it's also been associated with insulin resistance. There's more to it sometimes than just our food intake. And we always really have to dig and
Yeah,
look
I
for
mean,
that when we're working with our patients.
for sure, we call these things obesogens, and there are other things like the microbiome. So
Yeah.
maybe we can share a little bit about that and what we're learning.
Oh, the microbiome, I think, is so fascinating, right? I mean, there's so much information there that we're learning, and there's going to be so much more that we're going to learn over time. And I don't think we have it obviously all figured out, but we know that there's certain bacteria in our digestive system that are associated with less inflammation and a healthier weight. And there's certain bacteria in our digestive system that are associated with more inflammation in the body and having an easier time with weight gain. So it's
Mm.
fascinating, the association between the microbiome and this whole process of insulin resistance.
Anytime there's inflammation, it drives insulin resistance, independent of the cause. So the biggest cause, just not to get too down on that rabbit hole of these things, the biggest cause obviously is sugar and starch. Those are the two biggest things that are driving inflammation. But there are a lot of other things that people need to think about that also do it. Now, people listening might be going, okay, yada, yada, yada. Okay, all this great science about belly fat and what it does and why it's bad and how to test for it and, what causes it. But how do I get rid of it is the big question. How do you actually get rid of it? And I think it's so gratifying practicing functional medicine and at the Ultra Wellness Center where we work. It's so gratifying seeing this because this is one of those kind of slam dunk idiot proof things for most people. And it happens so quickly. And it's so striking because people are always struggling with this. I'm like, well, if you understand biology and how the body works and how it functions, which is really the foundation of functional medicine, which is understanding how to work with the body rather than against it, you can drive these biological changes really quickly. So let's talk about, what do
Yeah, very
you
good.
do and some case studies that you've had that really sort of illustrate the ways in which we can use this strategy of function and science, functional medicine and the science to drive real change for these patients in their not only their belly fat, but all the
Yeah.
other biomarkers and health issues and consequences that come from having this belly fat.
Absolutely. Like we were talking about, the visceral adiposity, that belly fat is associated with high levels of insulin in the body and insulin resistance. And that means that the body isn't listening to its insulin as well as it used to. And so that high level of insulin, as you mentioned earlier, causes us to store calories and to just gain weight. It makes us more hungry, but it also makes it much harder to lose weight. So one of the things we when you were talking about, okay, how do we really work with our physiology, is we want to prevent insulin spikes because we know that higher levels of insulin are what's really driving us to gain this visceral adiposity. And so, as you mentioned, it's those refined carbohydrates and sugars that drive up insulin levels in the body. And we know that if we just ate just fat, we wouldn't secrete a lot of insulin. And protein, we secrete some insulin, but not as much as with carbohydrates. So what's really important is bringing down the percentage of calories that somebody's getting from carbohydrates, especially the refined and processed carbohydrates that cause that insulin spike. And so I always talk to people about that, having that balance of the, good healthy fat and lots of fiber and some protein at every meal, and just pulling away the simple sugars and refined carbohydrates, because that brings the insulin down and makes us less likely to hold on to that weight around our belly.
So, like you said, how do you cut insulin levels? Well, you've got to cut out the starch and sugar, especially if you're in an extreme case. If you have a lot of belly fat, you really need to be more strict, like no sugar, grains, beans, even some fruit. And then as you start to become more metabolically healthy and resilient, you can add things back. But it's really key to be really religious about it. And also, there are other factors like artificial sweeteners that are driving this, and or other
Yes.
carbohydrates we might think are okay, like we're eating whole grains or eating whole wheat bread or eating, but they may not for people who are really insulin resistant. It's a really gratifying area, and I think when you look at aging, when you look at fertility, when you look at chronic disease, when you look at productivity, when you look at your brain function, all those things are related to this belly fat, and it's really the sort of the drumbeat that I and we have been sharing for decades at the Ultra Wellness Center, which is it's really about the quality of the food you eat, the quality of your diet. If we can get this straight, we're going to solve so many of our global issues around health and chronic disease, the economy, and everything else. So it's kind of an exciting moment where I think this is becoming more and more recognized. I literally just got off a call with a senator really and his team about how we begin to address this through policy. So I'm kind of optimistic. I'm always a little bit optimistic no matter what anyway, but I think I'm more optimistic than ever that we actually have a moment to start to change the tide on this.